Alright, welcome everybody. I want to welcome you to another video lesson from ICU Advantage. And this is going to be our second lesson in our series of lessons on ABGs. And for this lesson, we're going to do a dive into our blood gases and what exactly is going on with that. And for those of you who don't know, my name is Eddie Watson. I am going to be presenting this series of lessons for you. And as always, we invite you to subscribe to our channel in order to stay up to date on our videos as they become available. Make sure and hit that bell icon though and hit all notifications in order to get those notifications as soon as the videos become available to you guys. Alright, so let's go ahead and get into our lesson here. Like I said, we're going to be talking about the blood gases and what's happening with these gases through the whole process that leads to our bodies utilizing and releasing these gases as a result of that metabolism. It's important to know this information to really understand how that process is working and how we end up with the numbers that we see within our blood gases when we run them. And primarily when we're talking about these blood gases, we're really focusing on two different ones. We're looking at our oxygen as well as our carbon dioxide. And so as we talk about the blood gases, what we're looking at is the concentration of these two molecules, of the oxygen and the carbon dioxide. And the values of these concentrations are going to change from the air into the alveoli and in our lungs and in our blood and in our tissues. And the way that we're able to measure this concentration is something that we call the partial pressure. And so when we measure these values, that partial pressure will essentially tell us what is the concentration of these gases in whatever area we're checking. And so if you have a higher partial pressure, then you would have a higher concentration or a higher amount of that particular gas. And so let's pull up a diagram here and kind of talk through some of what's happening. So we're going to start off by talking about what this pressure is in the atmosphere. And really we can think about this as the concentration of these gases when we inhale. And so in the atmosphere, the oxygen is actually going to greatly outnumber the amount of CO2 that's in the air. And so if we were to measure the partial pressure, we would see a partial pressure of the oxygen, which would be about 160. And we would find a partial pressure of carbon dioxide to really be a small amount. It's really less than 0.3. Now there are other gases in the air. In fact, the nitrogen content makes up much more of the air that we breathe in. But when we look at the oxygen compared to the carbon dioxide, it's significantly more in the air that we're breathing in. So really we're breathing in that oxygen-rich air for our bodies to utilize. Now after we've taken that in and our bodies have used the oxygen in metabolism and they've given off the carbon dioxide as the waste product, the air is going to come back out and we're going to have our exhalation. But believe it or not, we're actually going to still have quite a lot more oxygen than we do CO2. And so in our exhaled air, we're going to have a PO2 of 120, and we'll find a PCO2 of 27. And so here you can see that CO2 that's come as a result of the metabolism. But you also can see that of the oxygen that we breathe in, we really just use a small amount of that. We don't use all of it. And again, when comparing that production of CO2 that we make, it's still small compared to the concentration of oxygen that's in the air around us. Throughout this lesson, I am going to be throwing around a lot of these numbers, and particularly when we're talking about the level of the blood gases, these partial pressures throughout this process, it's not so important that you memorize those numbers, but that you understand the concepts behind them. And it'll be later on when we talk about some of the values that you're going to be getting on the ABG or the blood gas that you draw from your patient. Those are going to be the values that you're going to need to know, and we'll talk about that when we get to that point. And so now we have this air that we have inhaled from the atmosphere. And so let's just take a quick review through that flow of air and where these gases are going in the respiratory system. Again, this is a quick review from our previous lesson, which I'll go ahead and link to up above. But if you remember, the air is going to come down our respiratory system, entering into our lungs, and from there it's going to go down into our alveoli. Now, in addition to the air coming there, we also have blood coming there from the heart. And so if you remember, we have the deoxygenated blood coming from the pulmonary artery, and that's going to be coming up here and branching down and forming into our pulmonary capillaries. Again, remember, this is our deoxygenated blood. And now it's within these pulmonary capillaries that gas exchange is going to happen. And so the blood is going to leave the pulmonary capillaries and enter into what we call the pulmonary veins, which are going to return the blood back to the left side of the heart. And so one really important thing to know is that in order for all of this to work, you're going to have adequate ventilation, which is going to be that moving of air in and out of the lungs, as well as you're going to have adequate perfusion, which is going to be getting the blood to those alveoli in order for that gas to take place. Now, we're not going to talk about all that within this lesson, but there's many different things that can happen both on the ventilation side and the perfusion side that can ultimately impact our ability to have this gas exchange take place. And so now let's go back up and talk about what's happening down in the alveoli as that air from the atmosphere has entered it. And so if we actually were to measure the partial pressure of the oxygen and the carbon dioxide here, we're going to end up with a different number, a different set of numbers than we would see within the atmosphere. And really what's happening is as the air makes its way down the passageways, these pressures begin to change due to several factors that ultimately lead to the numbers that we see at the end in the alveoli. But in the alveoli, we are going to find ourselves again with the oxygen still outnumbering the amount of CO2 that we have in there. But within the alveoli, we're going to end up with a partial pressure of oxygen that's about 104, and we're going to see a partial pressure of carbon dioxide at about 40. And so now within the pulmonary arteries, again, we have that deoxygenated blood coming from the right side of the heart to the lungs. At this point, the oxygen has been used up by the body, as well as the CO2 levels have increased as a result of that metabolism. And so within the pulmonary arteries, we're going to find a partial pressure of oxygen of 40, which is much lower as we would expect. And then we're going to find a partial pressure of carbon dioxide of 45. So again, an increase from where we were to start, but not as significant of an increase as the decrease that we see in the oxygen. And so what happens is as this blood comes into the pulmonary capillaries, we have a difference in pressure between what's in the pulmonary arteries and then ultimately the pulmonary capillaries, as well as what's in the alveoli. And just like with everything else that we deal with throughout the body, these gases are going to move from that area of a higher concentration into an area of lower concentration. So think it's going to go from higher partial pressure to lower partial pressure. And so as a result, the partial pressure of oxygen in the alveoli is 104, but only 40 within that pulmonary capillary. So we're actually going to see the oxygen move this way across the membranes. And since the partial pressure of the CO2 is 45 now in these pulmonary capillaries, yet only 40 in the alveoli, the CO2 is going to work its way across this way. And so these pressures or these concentrations of these gases are going to be trying to balance themselves out, which is why they move from high to low concentration. And so now we've had this gas exchange that has taken place. Oxygen has moved from the alveoli into the blood, and carbon dioxide has moved from the blood out into the alveoli. And so as that blood begins to leave out the pulmonary capillary and enter into what we call the pulmonary veins, we're going to find a much different concentration of these gases at this point. And so now we're going to find a PO2 of about 100, and as well as we're going to find a PCO2 of about 40. And so now we've gotten rid of some of that CO2, we've taken in a lot more of that oxygen for our bodies to use, we've returned that blood back to the left side of our heart, and ultimately this blood will make its way throughout the rest of our body to our tissues. And so once again, we're going to have our blood going from our arteries down into the capillaries at the tissue level. but we really haven't had any change in the concentration of the gases at this point. So again, we're still going to have a partial pressure of oxygen at 100 and a partial pressure of CO2 at 40. And this oxygenated blood is then going to make its way into these tissue capillaries. And so now down here in the tissues, they've used up the oxygen that has been delivered to them, as well as they've created all of this CO2 that now needs to leave. So within these tissues, we're going to end up with a partial pressure of oxygen that's less than 40 and a partial pressure of CO2 that's greater than 45. And so once again, we're going to find these gases move their way from the area of higher concentration to lower concentration. And so the oxygen in the blood at this point, which has a partial pressure of 100, but the tissues only have a partial pressure of 40 or less, we're going to see the oxygen move this way. And as well as if we look at the levels of our CO2, what our partial pressures are, we're 45 or more within the tissues, but only 40 within the blood. So once again, we're going to see the CO2 move this way. And so once again, we've now had that gas exchange take place. The blood will make its way out of the tissue capillaries into the veins and ultimately return back to the heart. And so again, we have this now deoxygenated blood with increased levels of CO2 entering into these veins. And so we're going to end up finding a partial pressure of oxygen of about 40 and a partial pressure of CO2 of about 45. And again, this is going to make its way back to the right side of our heart, ultimately coming out into our pulmonary arteries, bringing us back up here, ultimately leading towards the alveoli with that same level of these gases, and this process repeats again and again and again. And so hopefully this diagram has helped to make things a little easier to understand in terms of why that gas exchange is taking place, how things are shifting and changing depending where we are throughout the body. And so now with all of this that's happening, we can actually do some checks of these gas levels within our blood in order to kind of see what's going on. We can sample some of this blood from an artery here, and we can check these pressures in what we call an arterial blood gas, or what we'll commonly refer to as an ABG. And when we get the results from this ABG, there's really a couple main things that we're looking at. There are some additional tests that you can sometimes run with these, but the primary things that we're going to be looking for are the pH level of the blood, what the partial pressure of the oxygen is within the arterial system, what the partial pressure of the carbon dioxide is within the arterial system, what our bicarb level is, as well as what our oxygen saturation of the hemoglobin within this arterial system. And so now here is when we're going to start to see some of these numbers that are going to be important for you to know and memorize in order to be able to make determinations of what's happening. And so first, when we look at our pH, we're going to have a normal value that goes from 7.35 to 7.45. And this number is going to tell us whether we're dealing with an acidosis or an alkalosis. The lower the number, the more acidic, and therefore the acidosis would be less than 7.35, and the higher the number, the more alkaline, therefore anything greater than 7.45 would be our alkalosis. Now our normal number for our partial pressure of oxygen within the arterial system, or the PaO2, is going to be 80 to 100. And this number, anything less than 80, is going to be telling us whether our patient is dealing with hypoxemia. And then looking at the partial pressure of carbon dioxide within the arterial system, or our PaCO2, our normal values are going to be 35 to 45. And these numbers are easy to remember because it lines up with the normal values for our pH, if you think about that 7.35 and 7.45. But there is a little caveat to this, and we will talk about this in the next lesson. But essentially, this value of our PaCO2 is going to be an indication of how our respiratory system is working. Now next, we're going to be looking at our bicarbonate, or bicarb as we often call it, which is going to be our HCO3 negative. And our normal value here is going to be 22 to 26. And this bicarb value is going to be looking at our metabolic system and how that is functioning. And so finally, the last number that we're going to look at here is our oxygen saturation. And this number really can vary depending on what source you're looking at, but really we're looking for anything that's greater than 95%. And so, like I said, it's going to be really important that you learn and memorize and know these numbers, because when it comes to interpreting your ABG, you can't do that without knowing what these normal values are. So now, in addition to this, we can also sample blood from the venous side, which will give us different numbers and be able to tell us different things than if we were looking at the arterial blood gas. And so now here, for the sake of this diagram, I'm drawing this blood blue. Obviously, our blood is not going to be blue in the venous system. It's going to be that darker red as opposed to that bright red that you'd see within the arterial system. And really, these differences between the colors is really exemplified if you've ever seen a patient on ECMO, where you have a machine that's providing the oxygen outside of the body. And so in the tubes coming to the ECMO circuit, you've got that dark deoxygenated blood, but then the line running back to the patient is now oxygenated with that bright blood, and you have the two oftentimes side by side, and you can really see that distinct difference between the two. But so going back, now we've pulled our venous blood gas, which oftentimes we refer to as our VBG. And again, we're going to be looking at these same numbers that we were looking at in the arterial blood gas, but these numbers aren't going to be important for you to memorize. I just want you to know the differences that you would expect to see, and hopefully it'll make sense on why we would see these. So again, we're going to be looking at our pH, our partial pressure of oxygen within the venous system, our partial pressure of carbon dioxide within the venous system, our bicarbonate or our bicarb level, as well as the oxygen saturation within the venous system. Now, you will find some differences in the oxygen saturation depending where you draw this from, but again, this is going to be beyond the scope of this lesson. And so now if we look at our pH, we're actually going to have a more acidic pH than we're going to find in the arterial system. And this is going to be as a result of there being more CO2 than we have in the veins versus the arteries. And so we're going to find our normal values between 7.31 and 7.41. And so for our partial pressure of oxygen within the venous system, we're going to see a number between 30 and 40. And again, if you just think about, our body has used up all of that oxygen. But it is important to make a note or distinction here that the VBG is really going to be useless for assessing our patient's oxygenation status. For our partial pressure of carbon dioxide within the venous system, we're going to find a normal value between 41 and 51. And so again, we have more of that CO2 as a result of that metabolism that has taken place, therefore leading to higher concentrations in this blood. Our bicarb is also going to be a little bit higher than we would find in the arterial side in order to try and make up for that increased acidity as a result of the increased CO2. And so we're going to find a value between 23 and 27. And finally, our oxygen saturation within this venous system is going to, again, be reduced due to the fact that we've used that oxygen for that metabolism. And so here our normal value is going to be somewhere in the area of about 75. All right, and so moving on, I do want to talk a little bit more about that gas exchange that's taking place at the level of the alveoli, as well as the level of the tissues. And I want to talk about some of the layers of the tissues that these gases must cross in order to have this gas exchange take place. And so starting out within the alveoli, if we look at the oxygen, we're going to follow the path of oxygen right now. The oxygen is within the alveoli, and the first area that it has to cross is a layer of fluid that we call surfactant. And so if you think the oxygen is going to have to make that transition from a gas in the air to a gas within fluid. Now the next area that the gases are going to have to diffuse across is the layer of cells that make up what we call the alveolar cell wall. The next area to cross is going to be the basement membrane for those alveolar cells. And next, we're going to have to cross a collection of proteins that make up what we call the connective tissue. From there, we're going to have to cross another basement membrane. And after crossing that membrane, we're going to have to diffuse across the layer of cells called the capillary cell wall. From there, it's going to move into the plasma, which is that liquid portion of our blood. And finally, from there, the majority of the oxygen will make its way into the red blood cell. And so if you really think about that, it's a lot of layers and areas that these gases are having to diffuse across. And if you think about the CO2 is having to make the exact same trip just in reverse. And so it's quite amazing that this gas exchange is able to take place. And in addition to that, there are problems that can come up that can impact different parts of these layers that can ultimately impact our body's ability to have this gas exchange take place. And so now if we look down into the tissues, again, the oxygen and CO2 must cross a series of barriers or layers similar to what we see in the alveoli. But we also have the addition of the interstitial fluid, which is going to be between those cells and the capillaries. And so the last thing that I want to talk about now is how these gases are actually transported throughout the body. And so for that, we're going to look at both our oxygen and our carbon dioxide. And so for our oxygen, we are going to find some of it is going to be dissolved within the blood, within the plasma. But the vast majority of it is going to be bound to the hemoglobin molecule within the red blood cell. Now, when we look at our carbon dioxide, things are going to be a little bit different here. For our carbon dioxide, we're going to actually find about 10% of it is going to be dissolved in that plasma. And when it's in the plasma, there's a natural reaction that takes place when carbon dioxide is around H2O or water, is it's going to end up forming a molecule that we call carbonic acid. And so again, if you think this is going to cause our body to be more acidic, and then also, in addition to that, a large portion of that carbonic acid is going to dissociate into bicarb, or HCO3, and hydrogen ions. And if you remember, hydrogen ions are going to be acidic, and this is oftentimes what we're measuring when we're measuring the pH of our blood, is that concentration of hydrogen ions. Now from here, another 20% of the carbon dioxide is actually going to be bound to the hemoglobin molecule as well, forming what we call Carb Amino hemoglobin. And so this is a pretty interesting thing that actually takes place. And if you think about with this very simple drawing of hemoglobin, normally we have our oxygen that's bound in the middle of these groups. And so what will happen is when the carbon dioxide binds, due to that higher concentration of that carbon dioxide, it's going to decrease the hemoglobin's affinity, or its natural ability or desire to want to hold on to oxygen, and that's going to cause that oxygen to be released and ultimately used by the tissues. And once this hemoglobin makes its way back to the pulmonary capillaries, due to that change in pressure, that CO2 is going to release from the hemoglobin molecule, increasing that affinity that it has to bind with oxygen. And again, you're going to get that oxygen to bind back into that hemoglobin molecule. Some very cool stuff. A lot of very interesting things that go on inside of our body. All right, and so then finally, the last and most abundant way in which the CO2 is transported throughout the body is actually in the form of bicarb. And this makes up about 70% of the CO2. And without going too in-depth into this, what's really happening is we've got our red blood cell here. And we actually have some transport proteins in here. And what these will do is they'll take the CO2 that's outside of the red blood cell in the plasma, and it will help transport it inside of the red blood cell. Now, like we talked about, 20% of this CO2 is going to go and bind with that hemoglobin, forming that Amino hemoglobin. But what's actually happening to a majority of this CO2 is there is an abundance of a protein that we call Carbonic Anhydrase. And basically what this does is it massively speeds up the transition of carbon dioxide to carbonic acid, which again, if you remember we just talked about, is going to dissociate into those hydrogen ions and bicarb, again, increasing the amount of hydrogen ions, which is ultimately going to decrease our pH, leading to a more acidic environment. All right, well, we did cover a lot here, and really the whole point of this again is to have you not memorize all of what's happening here, other than primarily those normal values for your ABG, but really to give you that understanding of intuition of what's happening from the time the oxygen and carbon dioxide is in the atmosphere, how it goes through the respiratory system, how we breathe it in, that gas exchange takes place, how that changes and transitions throughout the body in order to aid ultimately in the metabolism, which is the whole point of this system. It is a very complex and very unique, but what I would consider very interesting process. And I think having an understanding of this forms a very good foundation for you moving forward in the care that you can provide to your patients. All right, and so with that said, as always, I really truly want to thank you for watching this video. I hope that you found this information to be useful for you, that you found it informative. And if you did, I would really hope that you would hit that like button down below, because it does help to get the word out about our channel. In addition to that, leave us a comment and tell us what you thought of this video, and as always, feel free to ask any questions that you might have. And finally, we do invite you to subscribe to our channel below. And from here, make sure and check out the next lesson in this series, which is going to be on actually how do we interpret our ABGs. Or also feel free to check out another one of our great series of lessons that we have covering shock. And with that said, I want to thank you for watching, and we'll see you guys in the next lesson.